I'm Shayna Bandy. I am a cardiovascular specialist. I am an EP specialist, and I'm also a vascular specialist. I've been at Hillcrest for 13 years. I have been doing my job for approximately 35 years. I came out of high school. I went to Northeastern State University, got my 60 hours of pre-education. I had a big emphasis in math. In radiology, there's a big emphasis in physics. We deal with radiation physics, protection of the patient, the physician, and yourself, and your responsibility as everybody in the room as well. So I think you should have a great emphasis in math. Be prepared to take care of patients, be very hands-on, put yourself in their position, be very empathetic. I think you should also keep in mind you are sometimes the last person they ever speak to, and that is a very important part of our jobs because their loved ones can't come back with them. And so you have to stand in their place and be willing to listen and to get ready for whatever comes. Radiology, most people think it's just taking a picture in the ER of a broken bone, and my field has covered way, way more than that. I've been able to work in the industry. I have been able to work in the mammography area. I've been able to teach surgeons how to use breast biopsy equipment. I've been able to teach how to put closure devices in. I have been lucky enough to participate in a teaching facility and we were very busy in interventional radiology. I became a shared employee with the cath lab, and I spent 23 years of my life doing that. So I would say, keep your mind open. It's very exciting. Some of these people, they turn around and they become PAs, and they turn around and they're physicians, and it's a very exciting area. It's just a very big, growing area. It's not just taking pictures of broken bones anymore.
My name is Erin Cox. I've been here for just about 7 years. I'm an RCIS, which is a registered cardiovascular invasive specialist. But basically my job is I stand next to the doctor and I'm handing him equipment, wires, catheters, things that we go up into the patient's heart to look in through the x-ray. I love what I do as an RCIS just because my whole side, both sides of my family, heart disease runs very deep. So I just wanted to learn more about cardiovascular care. And I absolutely love what I do. I love helping save lives. Somebody's having a heart attack and go in and open that artery up and they live another day. I talk about all the time that all these people are my siblings. We talk, we laugh, we have fun. Sometimes we might have an argument, but like I've always said, when it's time to get serious, we get serious, and that is what we're here for. One of the big things for me is empathy. That the patient on the table, you could be the last person that they see. So it's really important to have that compassion for them and to let them know that you're here for them and you're going to do everything you can to take care of them. If you're a people person, then it's great.
My name is Gabe Renfro. I've worked at Hillcrest for 17 years in the cardiac cath lab, and I'm a registered nurse. My cath lab journey started in nursing school when I went to a cath lab in Tahlequah City Hospital, and I watched a group of people come together and save a man's life that was having a heart attack, and I thought, this is probably what I need to do. That being said, I spent the rest of my time in nursing school getting out of going to the floor or going to any other unit and going back to the cath lab. It got me in a lot of trouble. Being in the cath lab for me is probably the change in technology and the instant gratification that comes with saving a person's life during a heart attack. It's an amazing thing to go from somebody is going to die on your table to watching them eat cheeseburgers and hang out with their family in a room down the hallway. For a nurse, the difference between the cath lab and electrophysiology would be electrophysiology is we work hand in hand with nurse anesthetists and anesthesiologists to sedate the patient and do any medical care that we need to do. In the cath lab side, the nurse does the moderate sedation and the medical care of the patient with the direction of the physician that's in the room at all times. There's multiple ways to do a bachelor's degree. You can get your associate's degree and then go on to be a bachelor's nurse. You can get all of your prerequisites here in Tulsa and have a degree as a bachelor and do there's a one-year certification at the Houston Center at OU. But there are all manner of ways to move up in nursing. The role of being a nurse in the cath lab has a lot of management aspects to it. You're kind of in charge of the flow of the room and the flow of the day and the vibe of all of the people in the room. That really fits my personality. If you come out of high school and you think you want to be in any kind of medical field, don't pigeonhole yourself into one medical job. Shadow as many people as you can and take as many science classes as you can before you decide to do that one thing, because you never know what you're going to find on your way through your journey.